Have you ever wondered why you feel tired even after a full night's sleep? It's a question many of us have asked ourselves, and it's a puzzle that can seem impossible to solve. Imagine this. You've done everything right. You've shut off your devices an hour before bed, your room is dark and cool, you've avoided caffeine and alcohol, and you've gotten your recommended 8 hours. Yet, you wake up feeling as if you've barely rested at all. You're not alone in this. Many people experience this fatigue, and it's not just because they had a rough night or they're not a morning person. The culprit could be a sleep disorder. Among the myriad of sleep disorders, there's one that often flies under the radar, yet affects millions worldwide. It's called sleep apnea. Sleep apnea is a serious sleep disorder where your breathing repeatedly stops and starts during sleep. It's like trying to rest while someone intermittently holds a pillow over your face. Not very restful, right? Sleep apnea is more common than you might think. In the United States alone, it's estimated that over 20 million adults suffer from this sleep disorder, with the majority of cases still undiagnosed. That's a staggering number of people whose nights are filled with unrestful sleep and whose days are clouded in fatigue. The impact of this disorder extends beyond just feeling tired. It can severely affect your quality of life, leading to issues like daytime sleepiness, difficulty concentrating, and even more serious health problems such as heart disease and diabetes. The world of sleep is a complex one, filled with mysterious disorders like sleep apnea that can turn our nights into a battle for rest and our days into a struggle against fatigue. It's a world we're going to delve into to understand why so many of us feel tired even after a full night's sleep. So it appears that a good night's sleep may not always be as restful as it seems. But what exactly is sleep apnea, and how does it steal away your peaceful slumber? Sleep apnea, you see, is a rather common yet often overlooked sleep disorder. It's characterized by repeated interruptions in your breathing while you sleep. These pauses can occur several times an hour and last for 10 seconds or even longer, leading to a broken, unrestful slumber. There are primarily 3 types of sleep apnea. First, we have obstructive sleep apnea, the most common form. It happens when the muscles in the back of your throat relax, narrowing or closing your airways as you breathe in. You might not even realize that you're struggling for breath, but the lack of oxygen jolts your brain awake, causing you to gasp or snort. Next, we have central sleep apnea. This type is less common and more sinister. Central sleep apnea occurs when your brain fails to send the right signals to the muscles that control your breathing. Unlike obstructive sleep apnea, it's not a problem with an airway blockage but rather a communication breakdown between your brain and your body. Last but not least, there's complex sleep apnea. As the name suggests, it's a combination of both obstructive and central sleep apnea. It's a complex issue where your body is fighting against both a blockade and a miscommunication. Now you might be thinking, what triggers these interruptions? Well, the causes can vary from obesity and age to smoking and alcohol consumption. Even certain medical conditions like heart disorders and hormonal disorders can lead to sleep apnea. The main symptoms? They range from loud snoring and gasping for air during sleep to waking up with a dry mouth and morning headaches. You might also find yourself feeling excessively tired during the day, even after a full night's sleep. Sleep apnea, it seems, is a sneaky thief in the night, robbing many of us of restful sleep. But don't worry, understanding the problem is the first step towards finding a solution. In the next scene, we'll explore the consequences of sleep apnea and why it's so important to address this silent nighttime bandit. Sleep apnea doesn't just rob you of sleep, it can also have serious health implications. Now you might be wondering, what kind of health implications? Well, let's dive into that. One of the major concerns about untreated sleep apnea is its potential to lead to cardiovascular issues. When your body repeatedly stops breathing during sleep, it can cause fluctuations in your blood oxygen levels and blood pressure, leading to strain on the heart. Over time, this strain could contribute to heart disease, one of the leading causes of death worldwide. Moreover, with each pause in breathing, your body experiences a moment of stress, which can increase the risk of developing arrhythmias or irregular heartbeats, which can lead to sudden cardiac death. But the heart isn't the only organ affected. The brain also faces significant risks. You see, the brain needs a constant supply of oxygen to function properly. When this supply is interrupted, as in sleep apnea, it can potentially lead to stroke. Studies have shown a strong correlation between untreated sleep apnea and an increased risk of having a stroke. Moving on, let's not forget about the mental health aspect. Chronic sleep deprivation, which often goes hand in hand with sleep apnea, can lead to mood changes, anxiety, and depression. It's not just about feeling groggy or irritable. It's about a significant decline in quality of life. which can impact everything from your job performance to your relationships. So, it's clear that sleep apnea is not a condition to be taken lightly. It's not just about snoring loudly or feeling tired during the day. It's about serious, potentially life-threatening health conditions that can occur if it's left untreated. That's why it's so important to seek medical advice if you're experiencing symptoms of sleep apnea. And remember, the consequences of sleep apnea are not just about what happens when you're asleep. They carry over into your waking life, affecting your overall health and well-being. So, sleep apnea is not just about snoring and tiredness. It can be a serious health issue. If you're wondering how to know if you have sleep apnea, it's all about recognizing the signs and seeking help. Sleep apnea is diagnosed through a combination of medical history, physical examination, and specialized tests. It's a process that requires the expertise of a medical professional who will guide you through every step. Your journey to a diagnosis starts with an evaluation of your symptoms. Snoring loudly enough to disturb your sleep or that of others is a common sign. Waking up feeling out of breath, having a dry mouth or throat upon waking, experiencing daytime sleepiness or insomnia, and suffering from morning headaches are other symptoms to look out for. If these symptoms sound familiar, your healthcare provider may delve into your medical history. They'll want to know if you have a family history of sleep apnea, if you're overweight, or if you have a nasal obstruction due to a deviated septum, allergies, or sinus problems. They'll also ask about your lifestyle habits, including smoking and alcohol use, as these can contribute to the development of sleep apnea. Physical examinations are also crucial. Your doctor may check your throat, mouth, and nose for extra tissue or abnormalities, as these can obstruct the airway during sleep. But the most definitive way to diagnose sleep apnea is through a sleep study, also known as polysomnography. This test records your brain waves, heart rate, breathing, and blood oxygen levels while you sleep. It's usually conducted in a sleep center, but sometimes it can be done at home using portable equipment. The results of your sleep study will provide a clear picture of what's happening while you're asleep. It will reveal if you're experiencing episodes of breathing cessation and if your oxygen levels are dropping during these episodes. Remember, it's essential to seek help if you're experiencing symptoms of sleep apnea. Ignoring these signs won't make them go away. Instead, it could lead to serious health complications down the line. Remember, if you're constantly tired despite sleeping well, it may be time to talk to a doctor. Sleep apnea may be a silent thief, but there are ways to catch it and lock it out of your nights. Yes, it's true. Dealing with sleep apnea is not a one-size-fits-all process, but the good news is, we have an arsenal of treatment options at our disposal. One of the primary ways to tackle sleep apnea is through lifestyle changes. Simple things like maintaining a healthy weight, quitting smoking, avoiding alcohol and sedatives, and even changing sleep positions can significantly reduce sleep apnea symptoms. Next, we have continuous positive airway pressure or CPAP machines. These devices keep your airway open during sleep by gently providing a constant stream of air through a mask. While it may take some getting used to, many people find that it dramatically improves their sleep quality. For more severe cases, surgical options are available. Procedures can range from removing excess tissue in the throat, adjusting the structure of the nose, or even implanting a nerve stimulator that controls tongue position. It's important to note that these are typically considered only when other treatments have proven ineffective. But remember, each person is unique, and what works best for you will depend on the severity of your sleep apnea and your overall health. So always consult with a healthcare professional to determine the right course of action. With the right treatment, sleep apnea can be managed effectively, leading to better sleep and improved health. No more stolen nights of rest, just sweet, uninterrupted dreams.